My name is Alex Vanderby. I graduated in 2019. I'm a hospitalist at TMH.
And I'm Rachel Vanderby, his wife, not sister. And I graduated in 2019 and am currently a hospitalist at TMH.
Perfect. And I fell in love with the place and the faculty. The hospital seemed like it really welcomed the family medicine residency more than any other program any other rotation that I had. So I felt confident that I'd get good training and would be well supported.
And I didn't rotate as a med student, but I knew from Alex's experience that this was a program that we could trust since he had 6 weeks here. And then when we came here, we just got such a good vibe from our faculty. They were so supportive. It's a huge reason why we stayed in town and signed on to the hospital.
Well, as a hospitalist, I deal with very sick patients in high acuity, and I feel like the amount of patients that I had in the inpatient setting was pretty robust, and I felt like I had the autonomy to see sick patients by myself and with some input from the faculty, and I felt pretty strong about doing it, and I've gone right from residency to being a hospitalist, which not many people can do at a center this big, so I felt good about it.
Our inpatient service is so robust and we deal with so many acute patients that half of our current hospitalist program here is from graduates from this program. So I felt confident that I'd be able to transition straight out of residency and just completed my first year as a hospitalist, and it's gone really well.
Endings was the amount of different things that they've done in their lives and how it trickled down in different styles. I felt like when I came here as a student and as a resident, I never felt talked down to or small, or which I think was a big part of it. And I could ask any question, and all the attendings were willing to step in and teach me something new that I didn't know anything about.
Very healthy work environment. I loved being in residency, having my first child. I probably wouldn't have had two, but pre-COVID days, my daughter could come when she was a baby, and I felt supported by the faculty to allow for mother time, breastfeeding time, and it was very supportive faculty to our family's needs, and they sort of accommodated us to try to keep our schedules somewhat synced up.
If you're gonna come to TMH, you're gonna get good training. You're gonna work hard, and that's nothing wrong with that. You're a doctor for a reason. You're gonna work hard. You're gonna get a training that's full spectrum. You're not gonna miss out on very many parts of family medicine at all, and you can kind of pick and choose what you want to do for your program. So there's flexibility in the schedule to give you a little more of what you like and a little less of what you aren't that interested in.
I think if you come to TMH, there is something for everybody. You're definitely going to get adequate training in all fields: outpatient, inpatient peds, inpatient OB, prenatal care, and definitely adult inpatient medicine. And there's room and flexibility in the schedule and with the different faculty to dig deeper into one area if you're more interested.